Welcome along everybody to this Winslow Health webinar in conjunction with the Barwon Health Foundation. My name is Francis Trainer and I'm the Philanthropy Manager with the Foundation, and I'm delighted to be your host this afternoon. Let's start by acknowledging the traditional owners of the land. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders, both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this afternoon. And with me today, I'm very pleased to say we've got Nino Di Pasquale. So welcome along. Nino is the Director of Nursing for Barwon Health Mental Health Services. Welcome, Nino, and thanks for joining us.
Thank you. Thanks for having me.
And a special welcome to everyone from Winslow Constructors, both joining us live for this webinar, and also to all of you who are watching the replay at some point in the future. It's great to have you all on board. Winslow have been great supporters of the Barwon Health Foundation and by extension Barwon Health, and their amazing support has gone a long way to ensuring the best care of patients at our health service. And just as we're lucky to have University Hospital looking after the health of our community in the Greater Geelong region, we're also extremely fortunate to have the support of companies like Winslow, so we thank them very much for that. And not only are Winslow generously supporting their local health service, they obviously have great care for their staff to be conducting these health webinars, and I think this speaks volumes for the quality of the company and the people behind them. One of the big events that Winslow gets behind is the annual Run for Geelong, an amazing community event that this year goes virtual. Now, by virtual, that doesn't mean you can sit on your couch, but you can register now and run, walk or roll, or whatever takes your fancy, on Sunday the 15th of November over various courses for the good of the community and good health. For more details on that, including how to register, you can go to runforgeelong.com.au, that's run numeral 4, geelong.com.au, or to the Barwon Health Foundation website and read all about the activities. So thank you, Winslow Constructors, for your wonderful ongoing support with that event. Now, as I mentioned, we have Nino Di Pasquale with us this afternoon to discuss mental health. At Barwon Health, we're very fortunate to have world-famous head of psychiatry. And when I say world-famous, that's no exaggeration. His name is Professor Michael Burke, who is a leading researcher into mental health issues. And he's often said that for too long, there's been such a stigma with mental health issues that people were reluctant to talk about them. Fortunately today, we have a whole host of supporting organisations like Beyond Blue, Lifeline, people like former AFL footballer Wayne Schwass, and so many others who've opened up the conversations about mental health. Of course, mental health issues don't discriminate and can affect anyone, the young, the elderly, the fit and the not so fit, footballers, politicians, mums, dads, kids, white collar, blue collar, you name it, it's right through society. I was reading an article just yesterday that said that new data has revealed the shocking impact of the pandemic on Victorians, with the use of mental health services a whopping 77% higher in our state than the rest of the country. It's quite alarming. The Barwon Health Foundation is currently promoting the Shukka for Mental Health appeal. The campaign encourages us all to shukka up for mental health and share a gift of solidarity. Helping spread the word could be all it takes to change someone's life. So check out all the details on the Barwon Health Foundation website and send or share that simple gesture, a shukka, to let people know that you're thinking of them. Check in on a mate today. Now, Nino Di Pasquale is the Director of Nursing for Barwon Health's Mental Health Services and has been that for the last 3 years. His career has extended to some 25 years, having worked in senior clinical and leadership roles, such as a clinician on mental health crisis teams, a manager for mental health crisis teams, a clinical nurse educator, a senior psychiatric nurse, project manager of a variety of community and acute mental health programs. He's worked as an academic at Deakin and Melbourne universities, the program manager for community and bed-based mental health programs, and acted in the role as an executive program director. So you might say a fairly extensive resume, and a very busy man, Nino.
Yeah, good.
Having experience in mental health as a clinician, manager, leader and educator in a variety of roles and organisations establishes Nino's reputation as a leader in mental health nursing. Nino has a number of tertiary qualifications, including 2 at master's level in the areas of clinical mental health nursing, management, leadership and professional education. Outside of work, Nino is a martial artist, enjoys boating and sailing, and for the purpose of this audience, comes from a family from the construction industry, having grown up working in the family's construction and concreting business. And his siblings and father are all active in the building construction industries across Geelong and Melbourne. Welcome, Nino, and thanks for joining us.
Thank you. And yes, I do. I think the first time I picked up a wheelbarrow full of concrete was when I was about 9 or 10. Dad said, "You're big enough now, son, here we go," and took me onto a job site. So,
well, I can see that your bulk would help very much in that industry.
Yeah, it did.
Nino, before we talk about the specifics of mental health, can you just sort of tell us a little bit what you do as a director of nursing and an educator and a clinical nurse in mental health, and what are the sort of roles you take on a typical week?
Yeah. So as a director of nursing for Barwon Health's mental health, drug and alcohol services, I have this kind of governance oversight of all the clinical nursing practice, in particular for the mental health nurses in the workforce. And that means making sure they're up to date in their practice and that what we're doing is within the legislation and is safe and effective. The other part of that is that I extend into the clinical practice and influence care to people undergoing acute health treatment in the main hospital, where they might be getting surgery or something similar, and have a comorbid or a mental illness that emerges, especially under that stressful circumstance. So about the care and readiness for general nurses to provide care in that space as well. So I do spend a lot of time going to meetings, giving advice, writing policies, writing procedures, teaching both mental health nurses and general health nurses. When I think about what is it typically like for a mental health nurse, I can think about my son for a moment, because he's graduated his nursing degree and is now currently working on our acute inpatient unit as a grad nurse. And I spend a lot of time, not because he's there, but because I have a whole nursing workforce down on the Swanson Centre, emerging myself in that work. And they work really hard, those nurses. It's difficult to sometimes understand what it is they do, but the notion of therapeutic use of self, which is about nurses empathetically sitting alongside consumers, their carers and their family, supporting them through what is mostly a distressing experience. And especially in environments where we have consumers who are under the Mental Health Act and might not necessarily be there voluntarily. So, medication administrations, risk assessment, monitoring people's mental statuses, providing counselling and those kind of things, whilst also working closely with family and carers, would be the kind of typical way to understand what a mental health nurse does in brief.
Right. Look, it's obviously a massive and important area of the health service. So can you tell us the extent of the effect of mental health in Australia?
Yeah. Well, look, the Australian government is talking about, up to 45% of the population, the adult population from 16 to 85, will experience a mental health disorder sometime in their life. That's about 8.5 million people. Statistically, it's about 1 in 5. Sometimes you hear 1 in 4 of adults 16 to 85 will experience a common mental illness in the previous 12 months. That's close to 4 million people. And for children, about 1 in 7. So a little bit less, but still not great, at about 14%, where children from 4 to 17 years will have experienced a mental illness in the previous 12 months. And that's close to about 600,000 children in Australia at any one, time.
Yeah. And typically, who are the sort of people that Barwon Health see, and where do they generally get care for mental health issues?
Yeah, so Barwon Health is a tertiary mental health service. What that means is we're a specialist mental health service, and we tend to look after, sometimes described as the pointy end of the mental health spectrum. And what I mean by that is the high risk and low prevalence disorders. And that means really looking after people with significant and severe depression and suicidality, people with mania, people with psychosis, and people with complex trauma and personality disorders. Generally in the public, most people who receive mental health treatment will get that from their primary care providers. They'll go to their GPs, they'll work under mental health care plans and see psychologists or psychiatrists, and attend those kind of programs. Packages under NDIS as well, into the community managed mental health space outside of tertiary mental health services as well. So we really look after a small proportion, about 2 to 5% of people with mental illness, but those are the people who are at the most severe end of that spectrum. And the other thing to typically think about for mental health services is our inpatient unit, and across the state, inpatient units provide only a small part of the care. Most of the care, and I would say up to 80% of the care and staffing that we have, is out in the community looking after people in their homes.
Yeah, I know that like mental health issues come in various shapes and sizes, from feeling a bit off to needing to see bipolar, more serious problems. Can you describe some of the different illnesses and what they mean?
Yeah, I'll go through the main ones, and I'll start with depression. And fundamentally, depression's a mood disorder, and it's characterised by sadness, guilt, low self-esteem, and is often related to loss. It can be manifested or shown in slowing of activity. People can be agitated. They can have physical changes due to the slowing of activity. Depression is common, and it's important to understand the difference between unhappiness and sadness in daily life versus clinical depression. Most of us will go through at some stage those kind of sadness or unhappiness events in our lives, with relationship breakups, not getting a job and things like that. But these reactions are not necessarily regarded as clinical depression, but are part of everyday life, and that, our normal resilience and patterns of response would manage that. But the term clinical depression describes not just one illness, but a group of illnesses characterised by really excessive and long-term depressed mood, which affects a person's life overall, and can be accompanied by symptoms of anxiety and things like that, and usually requires treatment with antidepressants or something similar. The consequence of that sometimes is, suicidal and self-harm behaviour, and this can be linked to depression. It can also be linked to complex trauma and personality disorders, and occasionally with depression, we'll see that people have, suicidal behaviour, and it's considered to be a really self-directed, destructive, conscious intent to end one's life. And that's distinct and different to self-harm, and where we see patterns of self-harm in people who have past history of trauma and complex trauma and personality disorders. And that's usually, direct or indirect self-destructive behaviour that includes, activities such as reckless things like overdoses or cutting and so forth, but not necessarily as an attempt to end one's life, but to cope with the distress that they're feeling at one point in time, which is challenging for both the people experiencing that and for the clinicians differentiating between those. And that brings us, into that space of the notion of complex trauma and often adverse childhood events that can lead to personality disorders. And often when people think about personality disorders, they think about kind of split personality and this sort of stuff, but really it doesn't describe that. It's actually about a person's inability, because of maladapted approaches to managing distress and trauma in their developing years, finding it difficult to manage the normal emotional range of and distress that we in the normal population might otherwise manage quite well. And, describing people as going off the handle or, attention seeking or things like that will often be the ways we hear people describe personality disorders. There's a biological link to personality disorders, and a whole lot of research coming out in that space around the impacts of adverse childhood experiences and complex trauma. And that's why there's a lot of work people will notice that's happening in the mental health promotion space in particular around caring really for children at school age and adolescents into high school, and programs to help support better ways of managing stress and distress and emotional regulation, really about resilience training. You move from, that sort of depressive kind of stuff and personality disorders into mania and elevated mood. And, you hear people talk about, feeling manic or energized, but from the context of mental health, the person with mania or elevated mood has a really elevated and expansive moods, so much so that you have people that believe in delusional things, that they have great powers. Their importance is over and above what would be considered normal. They'll overspend, they'll have poor judgment, they'll experience rapid changes in their thinking and chase those changes. We call them flight of ideas and things like that. They'll often not sleep for days and become quite disinhibited, either sexually or even in terms of overactive and aggressive behaviour. And this is typical of bipolar mania and is often followed by a fairly significant depressive state. But we also have those who are unipolar and might experience long, extensive periods of elevation, which can be quite challenging and distressing for the person experiencing it and the family and carers involved. Psychosis and perceptual disturbances are usually the ones that we would link to things like schizophrenia, where we're talking about people who have cognitive impairment. And when I say cognitive impairment, that's about the brain's capacity to think and respond and to do things. And that relates to the fact that they're people who might experience hallucinations. Usually in psychosis, most of those hallucinations will be auditory, and the description is around hearing voices. There are other hallucinations that people can experience. And those hallucinations interfere a lot with thinking. There's usually delusions and usually paranoid delusions associated with those as well. And they'll interfere with thinking as well. And you'll often see people quite preoccupied, which means they're in responding or thinking about their internal experience rather than the world around them. And so sometimes that gets misunderstood, you know, when a person is staring, for example, for extended periods of time. They're actually not necessarily a risk to anyone around them, but more so responding to what's happening in their internal processes and their thinking. And, you know, often people experiencing psychosis can be misunderstood, talking to themselves or shouting out in response to voices, and can often be quite vulnerable to people in the general public. And, you know, I remember many years ago seeing a person that I knew at the time suffering a mental illness, and, you know, a father walking past with his toddler son, who I assume might have been 3 or 4 at the time. And because of the nature of that person's behaviour, responding to their voices, shouting out loud, they looked quite dishevelled. The father felt quite threatened by that. And rather than taking a wide berth and, you know, reassuring his son that it's okay, and he actually confronted the man and shirt-fronted the man and told the man, this needs to stop, this is enough, and had this kind of quick dialogue before he moved on. And that's that vulnerability that people with psychosis are sometimes experience, which is really about misunderstandings and fear. So can be quite challenging. Delirium's an interesting one when we think about mental illness. Delirium is not the same as the other kind of mental illnesses I just spoke about. Delirium has what we would call an organic cause. So there's usually an infection, or there's a toxin or something in the body that has changed a person's way of thinking. And, you know, this is the sort of thing that people might have with you know, urinary tract infection, for example, seen sometimes in the elderly, where they have acute confused states. And that's because of the infection and the temperature and so forth, and the body's experiencing. Sometimes we see it post-operation, where people have had a general anaesthetic, and that's had an interference as a toxin in their body interferes with their brain functioning and can cause people to be confused and agitated. And you see a lot of those, you know, YouTube videos that people take, or family members take, of friends after dental procedures where they've been under a light anaesthetic, and you see tearful, agitated states and confusion. That's an example of a mild delirium secondary to an anaesthetic. The other kind of deliriums that we see more commonly, or states of intoxication, you know, people can become psychotic from amphetamine use and methamphetamine use and ice. And this is fundamentally a medical condition and a delirium. but can have long-term impacts. It's the same with alcohol. Alcohol can be used in such high doses that can cause toxic states of psychosis and hallucinations. And then at the other end, deliriums where people are withdrawing from alcohol and become, quite severely delirious and potentially life-threatening seizures with that acute alcohol withdrawal. So delirium is not necessarily commonly known, but one of our really most dangerous kinds of illnesses that sit in the mental health sphere but cross over into the general health sphere. And then we have dementia, which is characterised by multiple cognitive deficits, which is thinking or brain deficits that include memory and consciousness. Cognitive function can be affected in dementia and include intelligence, learning, memory, language, problem solving, orientation, and those kind of things, and judgment. And a person's personality can also be affected. One of the critical things about dementia is that with earlier identification, the disorder can be sometimes and in some cases reversed. And about 15% of people with dementia with early intervention, there can be some reversing of the process and slowing of the process. So that's a snapshot. I'll just talk briefly about anxiety disorders and then we'll move on. And anxiety disorders are a bit like I suppose, this is the high prevalence disorder group that the general public, along with, some of the milder depressions experience. And they're a group of common mental health problems. About 1 in 4 people have an anxiety disorder that needs treatment at some time in their life. And other people might have severe, less anxiety, such as fear of spiders and those kind of things. But we normally fit them into generalised anxiety disorders, social phobias, specific phobias, such as fear of spiders or fear of flying. Or we also have panic disorders, obsessive compulsive disorders, and post-traumatic stress disorders. And these become problematic really when they start to interfere with a person's daily activities and ability to function normally and socially in the world around them.
Yeah. As I said, various shapes and sizes. It's quite amazing. How do we, Nina, how do we stay mentally healthy? And can you tell us a bit about mental health promotion?
Yeah, this is probably where the good work is done when you think about society and internationally across the world and coming out from the World Health Organization and talking about the prevalence of mental illness and what it's looking like into the future. The work we do at our end and the work that you often hear about where people have treatments with antidepressants or mood stabilizing medication, that's about treating the illness at a point in time. What we want to think about is how do we reduce the likelihood and the incidence. And in this workplace context, and I think it's amazing that Winslow are running this webinar, but raising awareness for workplace mental illness matters. It matters a lot because growing research is showing that the impact on mental health and wellbeing across physical health, happiness and productivity. And there's one study that was done a few years ago in Australia that said every full-time employee with untreated depression costs an organisation about $10,000 per year. So if you've got a large workforce and if you think about the sort of 1 in 4 or 1 in 5, that becomes quite significant. So there's financial benefit to webinars like this, which in themselves, in raising awareness, are mental health promotion activities. If we can reduce stigma, for example, so that we don't have the kind of behaviours like I described earlier with the man who, out of fear, confronted the mentally ill person and did that. We also, think about men and men's health and, by reducing stigma, by having programs like this and webinars like this, again, as an awareness raising campaign, it might mean that more men will recognise what's happening for them and go and get assistance. They might go to their homes and notice something different with a child, with a loved one, with a partner. And again, that awareness raising can lend itself to people getting treatment earlier. And early intervention is also considered to be a mental health promotion activity. The World Health Organization is saying that depression will be the #1 cause of disability in both the developed and developing worlds by 2030. So we've now only got 10 years to stop that from happening. And that's an amazing statistic coming out of the World Health Organization. And the best way to address this is really through mental health promotion activities, working to prevent and reduce the impacts of mental health and to promote mental wellness. So mental health promotion aims to maximise the ability of children, youths, young adults, older people to realise their potential, cope with normal stress of life and participate meaningfully in their communities. It really seeks to increase awareness and understanding of mental health problems and mental illness. It seeks to reduce stigma and discrimination and encourage help-seeking behaviour where it's needed. At an individual level, so for all of us individually and in our families, it focuses on increasing emotional resilience, reducing vulnerability to mental health problems through developing personal skills, self-esteem, which leads to increased capacity to cope with, transitions of stress in life. At a community level, it seeks to build healthy environments, schools, workplace, that foster inclusive and supportive social networks. At a structural level, when we talk about state level, it's concerned with ensuring that public policy addresses mental health and wellbeing. For example, promoting equity and inclusion and reducing discrimination through, responsible media commentary. And if I had to think about just quickly two, one that comes out, two actually that are quite clear in terms of mental health promotion. And whilst they don't seem to sit with mental health promotion, they are actually mental health promotion activities. The one that you see, the ad that markets the problems or the role modelling with the father who says, son, go and get me a beer. And the son goes and gets beer. And then you see this generational repetition of that. And of course, drinking alcohol is a very social, active thing. It's, it's okay in moderation and all those things. But we also know that still today, alcohol is our most problematic substance abuse in this country at the moment. When you hear about amphetamines and methamphetamine or ice, there's a lot of things that occur with that, and it is a very problematic substance, but still today, alcohol is one of our most problematic substances, generally used by the public across the spectrum. And this relates to, sometimes maladaptive coping, where it's used to treat depression, where it's used to treat anxiety, where it's used to treat social anxiety. And so that campaign is intended to identify that, what we do as adults when we pick up can after can after can, says to our children and the people around us, this is okay, and this is what you can do. And in fact, it's saying, actually, we need to do better at this, and we need to role model better behaviours. Similarly, the family violence ad that's out and about recently, where you call a mate out, and there's another ad that comes to mind about role modelling about that, but certainly the call a mate out, where you've got the handful of boys sitting around having a chat, and one, I think, gets on the phone and speaks to his partner or something similar to that, treats her quite badly, and his mates pull him up. And addressing family violence and violence is another mental health strategy and mental health promotion activity as well. And similarly, they show the footage of, in one advert too, the man who treats his wife quite badly in front of his son, and then his son's behaviour starts to replicate that. So that role modelling again. These are really, really good examples of public mental health promotion campaigns.
And Nino, what are some of the service priorities in mental health in your area at the moment that affect the community?
We're quite busy. We're busier than we've ever been, and this relates to the fact that we've got not only is the region we're in at Geelong growing, and it's growing significantly. We have for nearly the last 2 years, it'll be 2 years at the end of this year, had a Royal Commission into mental health in Victoria, and I've been privileged enough to give evidence and participate in the Royal Commission, as have a number of my peers, as have a number of people with lived experience that are employed by Barwon Health, and also consumers and carers that I know personally. And the outcomes of that are quite useful in that it helps us to recognise the deficits that we have in mental health services, in mental health delivery, and the limitations in resources and so forth. So for us at Barwon Health, there'll be recommendations that come out of the Royal Commission that will drive a lot of what we do. Already with the Royal Commission, we've been identified as requiring more resources in terms of beds in the region for mental health, or the equivalent to beds. So we'll be building a new aged care acute facility at our Macalla site. That'll be a 16-bed facility. What that'll mean is that it'll free up 6 of our beds currently in our inpatient site at Swanston Centre, and it'll add an additional 10 beds in our total beds, 16 beds in our total bed stock to the region. And that's really important. We'll also be able to build a purpose-built venue that will be contemporary. We'll have what we call co-design, so lived experience, people's voices will come into the design, and that'll be a real win for us in the Geelong region. At the moment, we have only half a dozen beds dedicated to our aged population, and we manage that, and we manage that reasonably well, and we provide the best care that we can. But this will bring us into a whole new space. That'll mean some work in terms of training and getting staff ready to staff that. We're also having renovations at our Swanston Centre site. The building is over 25 years old now. It's been around as long as I've been practicing as a mental health nurse. So it's undergoing some renovations right at this moment. We also have a new hospital in the home program. And what that'll be is really the equivalent of 9 beds, but for people who can be treated within their home with a high level of intense care within their home environment. And we have a lot of other initiatives. We have specialist family violence advisors working in mental health, building workforce capability so we can address family violence. And we have a specialist clinician with complex trauma and personality disorders that is going to help build capability across our organisation in addressing, people with personality disorders and complex trauma. So a lot of things happening for us, and a lot of good things happening for the region.
And would you like to tell us, like, some of the organisations that we can go to for mental health issues? Yeah,
what you'll notice, Victoria's mental health services, they'll all have a single point of entry for a mental health triage, and they can be contacted and they can be easily identified by going to, the department website or to, your local hospital website. But generally, the most useful services are those big national services that we have: Beyond Blue, Kids Helpline, Men's Line Australia, Lifeline, and the Suicide Callback Service. These are really high level and responsive organisations that are federally funded, and also funded through donations and fundraising activities that provide a lot of, like I said, I think being responsive and telephone based, and also computer based, are flexible in how a person can receive some initial treatment and advice. And beyond that, seeing your local GP or your local area mental health service is the way to go.
Yeah, fantastic. Yeah, we've just got over a lot of time, Nino, and I know there's a lot of pressures on your time. So thanks very much. That was really, really fascinating. And I guess just about everyone probably experiences some sort of mental health issue during their lifetime, or affected either directly or indirectly by the mental health of others. But it's the extraordinary and amazing healthcare heroes like Nino who help care and guide people through their issues. So we thank you for that, and we thank you for your time today.
It was a pleasure. Thank you for the opportunity. Every opportunity I have to reduce that stigma and think about mental health promotion, absolutely, I'll take it.
You're a good man, Nino. We might get you back to talk about the martial arts too at some stage. Now, in upcoming Winslow Health webinars, we'll be discussing heart health next week, and the final webinar for this session will be general health. That's in a couple of weeks' time. So thanks again, Nino. Really appreciate it. Thanks, Winslow, and thanks for everyone tuning in. I hope to see you all again next week. And please have a look on the Barwon Health website for the Shaka campaign. It's all about awareness and sending a Shaka to your mate. Now, I'm not very good at doing it, but do a Shaka, Nino, please. All right, good on you, mate. All right, thanks again. See you all next time.
Thank you.